Atherosclerotic Cardiovascular Diseases or ASVDs result from buildup of cholesterol deposits within the blood vessels of the body. It commonly involves three blood vessels. One, the blood vessels of the brain. It results in stroke. Blood vessels of the heart. It results in heart attack. Blood vessels of the extremities. It results in acute limb ischemia. These ASVDs are responsible for 1/3 of the deaths worldwide. If you see these cholesterol deposits start as early as at the age of 20 years, they build up slowly and result in above problems between the age of 40 and 80 years. If you identify them at an early stage, you can totally reverse them with medications. Even if you identify them at a later stage, you can stabilize them and prevent a major disaster. As for an AHA estimate, about 90% of these heart attacks and strokes are preventable. So we currently use an approach called risk factor based approach. What we do based on the risk factors like diabetes mellitus, systemic hypertension, smoking, family history of CAD, high cholesterol levels, age, male sex. So we create a risk score. It gives you what is the chance of having a heart attack, stroke in the next 10 years. Based on the amount of risk, we allocate preventive therapy in the form of lifestyle modification, cholesterol lowering medications, and aspirin. So what is the problem with this approach? You can see people with multiple of these risk factors still do not have a heart attack or stroke in their entire lifetime. In contrast, people with none of these risk factors still end up having a major disaster. Why does this happen? So based on this approach, we either overtreat people who are actually at a lower risk and undertreat somebody who is actually at a higher risk for developing these problems. So then, what is the best way to estimate this risk accurately? The best way is directly scan or identify the cholesterol deposits and its later stage called calcium deposits in the blood vessels. It is somewhat similar to what we do for cancer screening, where we use scanning techniques to identify early cancer and treat them. So what are the various things we have? We have two imaging modalities. One, ultrasound. This ultrasound can be used for imaging your blood vessels of the neck and the groin, where it shows cholesterol and calcium deposits. The second technique is CT scan, where we use the CT scan to identify the calcium deposits in the blood vessels of the heart. That is called CT coronary calcium score. So how does this additional information help? By putting this information together along with traditional risk score, it makes your 10-year risk estimation for heart attack, stroke, or limb ischemia very precise. It tells you whether you have to take cholesterol medicine or not. If you have to take a cholesterol medicine, what is the target of your bad cholesterol, that is LDL cholesterol levels? Are you going to get benefit from taking newer cholesterol lowering medications? Whether it is appropriate to take aspirin or not. If you have borderline blood pressure, it tells you whether you need to take blood pressure lowering medications or not. And if you're already taking blood pressure medications, what is your blood pressure target should be? And finally, if you're a diabetic, it tells you whether you're going to benefit from taking newer diabetic medications.